briefly to introduce myself, Adrian Wilmore. I'm the Strategic Solutions Director of Healthcare at Trustmarque, and my colleague Chris Kirk will introduce himself during the presentation, who is our Head of Cloud Data and AI Consultancy at Ultima. And together we are really transforming the way that NHS workflows happen alongside ambient technologies and integrating with things like EPRs. I do hope you're here to find out really how these technologies together can achieve a huge saving in clinical time across the UK and indeed globally, with the constant pressure that's being seen by clinicians. I think you'll all agree that sites like this probably belong in antique shops, and in reality we'd never ask clinicians to start typing up notes on typewriters that look like this. It would be a little bit unusual, to say the least. But there is actually a reality of this, that is that whilst the keyboards themselves may have been replaced by more modern ones that link to computer screens, etc., we've been asking, certainly over the last 20 years or so, clinicians to really start collecting more and more administration as systems become more complex, rather than the promise, which was to deliver productivity and reduce the burden on clinicians. And this is actually a relatively common sight for clinicians. Any clinicians on the call will recognise this probably, that they spend a lot of time on administration and not necessarily focusing on the patient, or indeed on other things such as improving the care services that they provide across the health systems in the UK, educating themselves and keeping themselves current, and indeed even pertinently having a coffee. Certainly my experience of working in things like improving frailty services across whole regions, and working with everything from GPs, nurses, geriatricians, ED consultants, etc. It's relatively common to see it being difficult to transfer data, and also very difficult to get away from the keyboard and the administration and really start to focus on patients and reducing things like waiting lists, etc. A very common sight. Just to give you a sense of the scale of that challenge, and these are NHS England figures that have been used in the past, up to about 70% of clinician time is spent on administration. That's at the high end, but it's absolutely recognised that somewhere between about 20–30% of clinicians' time can be spent on administration, which I think everyone would agree is definitely better spent on a patient and not on computer keyboards. In GPs, which we're well aware of, the difficulties of getting, for instance, GP appointments, around 44% of GP tasks could be automated. Certainly, the ability to capture recordings and create notes and letters faster will be supported. Will be a very supportive technology for GPs. And in reality, whilst systems have promised that they'll reduce the amount of time spent on clerical and admin time, over the last 10 years, the figures show something completely different, and that's that there's been about a 25% increase in the number of clerical and administrative heads in the NHS alone, going up to about 125,000 FTE of time spent on clerical administrative work. So it's kind of contra to that message. And that's where Microsoft Dragon Copilot comes in. So Microsoft Dragon Copilot is a dedicated ambient experience for healthcare, for clinicians. It's ambient because it's always on, it's always listening, it's always able to transfer to take a consultation or an encounter between a clinician and a patient, or a clinician and patients, and turn that into really valuable notes and support and speed up the workflows for clinicians. And that's a really important tool, and it differs from the likes of Microsoft Copilot 365, if those are things that you're familiar with, in that Microsoft Copilot 365 is a more general experience that can handle a very, very wide variety of different AI tasks. Dragon is dedicated and designed to support clinicians specifically and their workflows, and understand the context of a patient and clinician conversation. To give you a sense of scale of this at the moment, there's over 100,000 clinicians using Dragon Copilot worldwide, and over the last quarter, about 21 million encounters were captured using Dragon. To give you a sense of that against the size of that challenge, if it's freed up the amount of time that we'd expect, then something like 200 to 300,000 hours of care could have been freed up last quarter, and that growth is huge in the US and globally. So enough for me. I want to actually show you the tool now. So I'm just going to switch to the experience itself. Hopefully this will work. So I'm hoping everybody can see that. So how does Dragon capture the conversations? So first of all, you actually create a patient session. So as a clinician, I would be sitting down with a patient in whatever environment that encounter would happen in ED, in a one-to-one, in say an outpatient appointment in a GP practice. It's designed to work in all of those instances by capturing the conversation, recording the conversation between the clinician and the patient, and transferring that into an important set of notes. I'm not going to be able to run through a demonstration of that conversation today. We haven't quite got the time, and to be honest, every encounter is different. So if there are clinicians on the call, they'll recognise that their world differs from others. ED, very noisy, very busy. Often the follow-up appointments, for instance, from surgeries, etc., can be a much more quiet affair. And we are perfectly happy to come and work with NHS trusts and others to design experiences and to demo those experiences that work with those particular clinicians. So the first thing you do is create a patient session. And what you can see there is you can start to name the patient session, and indeed you can capture some of that information. And this screen will be the starting point for any clinical encounter. Two things I'll draw to your attention on this one. The first is that there's something called the Dragon Ambient Experience, DAX Copilot, on the right-hand side. And this is the important function that captures that conversation and does so in a way that's really clinically understood by the tools. And the second is Microsoft designing this tool so that it's genuinely hands-off keyboard experience. By incorporating the Microsoft Copilot 365 experience that you see. So instructions can be given on the left-hand side for things like changing stuff, and on the right-hand side, any of the conversation with the patient can be recorded, and indeed follow-up conversations happen. So as I said, I'm not going to actually record a session today. What I'm actually going to do is go to one I recorded earlier, and this particular one. This particular session is one I recorded that I think most people will be familiar with. In fact, it kind of plays a little bit to an encounter I had with my daughter who hurt herself at the gym. I think most people reflect sports injuries with teenagers are a common thing. And in this fictitious encounter, we go to a walk-in centre effectively and meet up with a clinician who wants to talk through the injuries that have happened. So what you'd find once the encounter happened, we recorded a 21-minute conversation here. That gets sent over to a service. It's in the UK. It's dedicated, and that service does all the magic. There's a general medical model, and a large language model in the background, really well trained on about 3 billion encounters, and that understands clinical language. So it can convert that recording into a really well presented transcript, understanding things like medical terminology, understanding things like drugs, medicines, etc. So it doesn't miss the nuances of those conversations. The audit is captured, so it captures all additional transcripts, and we'll see this changing in a second, and it converts that into a note, which we'll walk through, and also some documents that we'll all be relatively familiar with, certainly to clinicians, that help the workflow going forwards. In advance of that session, information can be captured. Just to remind a clinician, for instance, that that they might need to to carry out a particular investigation that's relevant to that patient alone. And then a note is created. So this note is created from the transcript, which captures the full encounter, the full 20 minutes or so of the solution, and is available to the clinician to look through, check for anything that's missed or any additions, and ensure that's captured in the notes. The notes capture the structure of the conversation, from presenting complaints and things like the social family history, where things aren't discussed. In this instance, we didn't discuss vaccinations, tetanus, etc. So nothing was included in there, so it hasn't picked up anything. But it absolutely starts to pick up all of the information right through to the examination findings, which in this instance included some checks against the bump on the head, and also a full exam around the ankle to understand what might be happening. And in fact, in this instance, the outcome was the need for an X-ray for cautionary purposes, and some basic planning to support in getting better over the course of 24 hours and a little bit further into until the X-ray results are available. And as you can see, it starts to capture all the current medications in detail, and how what's being taken, and also the outcomes of the encounter. Now, what's important here is this is very configurable. It's configurable in terms of style. So a clinician, for instance, can set up their own individual style. In here, I haven't turned that on in terms of auto, but it can be applied every time. You can make it more concise. You can they can look at presenting different information within, for instance, the exam findings. That really allow you to edit that template and create an experience for that clinician in that clinical setting. And you can also add additional information in. Styles are really important because, of course, for instance, I have a friend of mine who's both a consultant in general medicine, but also has a specialty in pediatric allergies, so would want to present things in two different ways when presenting things to children and parents around the allergies. Much more succinct, much more bullet point, much more clear, with shorter information and etc. Versus the consultations on the ward, for instance, which would be much more clinically presented. If the clinician chooses to change that style, they can apply it quickly, or as I said, it can be automatically applied. There are some other experiences. So, for instance, in terms of profile, at the outset, they can choose a particular role and also specialize that role against their particular specialties and secondary specialties. So you can see here I've chosen emergency medicine, and at this stage just another. I could have chosen to look at, for instance, any one of around, I think it is 75 different specialty experiences, and these are also backed off onto trained, developed models around the particular areas of specialties. At the outset in September, there was only one available. There's now at least 7 particular specialty trained specialty models that operate in the background. That support different types of services and settings. It's about the rate of 1 every month or so, which shows the investment and the speed at which these tools are improving. And further to that, individually, an organisation can create dedicated views and outputs for different services, and they can do that at all different levels of services, from the top into including setting out styles that the hospital mandates, right down to an individual service and indeed an individual clinician. That's set up in the background, and we're more than happy to show you how that works. but that includes things like text and vocabulary, i.e. recognising very specific terminology in that particular clinical encounter, or indeed in that particular region, so that the model itself understands things that are said. In frailty world, for instance, there's something called the Rockwood test. Ordinarily, that might come out as rock and wood in a flow. But you can train the tool to recognise that there is a specific examination and outcome, and then present as such. You can create prompts, which are really powerful because they can then set up inside any one of these areas the output of that clinical encounter in dedicated in the way that a clinician would want to. And also look at workflows which aid and assist the speed at which the clinicians can do things, such as moving information and data to different places and systems, setting up things like transferring things to documents, etc., and also potentially transferring things to the EPRs. In terms of how, just showing how powerful it is, for instance, I could, as a clinician, look at the note, and I maybe identify that something's missing, and then ask Dragon Copilot to add this. Hi, Dragon Copilot. Outside of the session, I discussed with the patient vaccinations, and I just wish to confirm in the vaccinations output that they are up to date with their tetanus shots. What happens is, in the background, any additions are tracked in terms of a timeline and audited. The service goes away, makes sure it understands what I've asked for, makes a note of the changes, and allows me to review them. And as you can see, hopefully it's worked. The vaccinations have been updated. Just a note that tetanus shots are up to date. Just an example of workflow, and many more, much more workflow will certainly be available. For instance, supporting things like orders. And order flow, which again clinicians will recognise coming out there. We need to get orders getting into systems quickly is a key challenge, but also things like clinical coding. In the US, for instance, there are also some really excellent experiences being developed around specialist services, for instance, for nurses and for mental health. All of these will move across to the UK and Europe in time as dedicated experiences, tested and working in an NHS environment. To show you, though, the three interesting documents that are always coming out of encounters: letters to GPs to make sure that the overall patient record is updated; patient letters, of course, which often take a long time to get to patients; and referral letters. I'll just look at the patient letter for now, and you can see it's captured the encounter, documented it, and in a way straight after the encounter that's available to a patient. So this could get to the patient almost during the encounter. But also you can capture some additional information after the encounter. So, for instance, I can look at adding to that. Hi, Dragon. Following the session, I had a conversation offline with the patient who was concerned that they didn't understand the RICE mechanism for supporting their potential ANCAL. I'd just like to make sure that that the record's aware of that, but also I'd like to update the letter to include a more dedicated understanding of the RICE approach. Thank you. And indeed, that would go off. Update the timeline. You can see it's transferred it. Go to transfer that additional conversation over to the service, into the timeline, and in due course would update the note and the document in the same way as before. Just given I'm not sure how long that's going to take, I'll come back to that in a bit, but move back to the presentation. That's a very quick sweet model. There's plenty more to see. And again, it would be really good to talk to anyone who wants to, in their specific settings, against their specific challenges, around capturing both the conversations and turning those into that really important workflow. So Dragon really is a true human plus experience, and that's what we really want to get across there. This is a model that works for the clinicians themselves. It allows them to focus on the patient. It allows them to remove something called cognitive load, which, if you can imagine a busy clinical diary, some clinicians will see 10, 15, 20 patients in a day, perhaps. Making sure you're keeping that all in your head whilst moving on from one patient to another is really a difficult task. It helps reduce that. It helps them to put their eyes on the patient, and the experience with the patient actually truly improves. And we genuinely see this as something that will improve over time to be something that releases a huge amount of potential, both clinicians, and also help to address the challenges we have certainly in the NHS. And in working in the NHS, as I said, this is a true NHS design service. The experience you see in the NHS in the UK is one that's been worked through with organisations like Manchester Foundation Trust. It's available in another 7 organisations, and they're seeing things like 3 to 5 minutes per encounter, even in the initial stages of testing of the model. But also, very importantly, they are absolutely seeing their ability to speed up the conversations, to focus on the patients, and hopefully then to improve the quality of those and to reduce the error that will nevertheless be creeping in. In scale, I've mentioned over 100,000 clinicians now on Dragon Copilot, and that's increasing at the rate of about 300% a quarter. It's huge growth, a big change, and those who are using it are seeing ambient technology as something that's really going to integrate their workflow. Someone's screaming out for it. And just into the future, much more is coming down. There's a lot of tools out there in the world at the moment that are potentially on the kind of wild west end of this spectrum. Microsoft focuses on quality. It focuses on building the scalable, really high quality platform that can scale as quickly up to national level. It's designed for national use, and but recognizing that other things will come along. So, for instance, context awareness. So it brings more information in from the EPRs to the clinician and allows that to integrate better. Roles-based experiences, I've mentioned those for nurses, potentially for mental health, that focus much more on the nuances of those, longer consultations, more mobility requirements, etc. And also integrating with a whole host of what we're calling partner AI apps. So, for instance, bringing in specialist understanding of clinical procedures and context awareness into a session to help a clinician not have to go out and look for that information and be able to deploy that right there in the session. So you need to design it for success. It is a technology that requires the ability to design. That means look at the environment and the clinical services and make sure it's really well worked into a clinical environment to achieve the types of benefits I'm talking about. We need to move away from the fact that over 20 years clinicians have been promised productivity improvements, and that hasn't been the case. So they have a very wise model of skepticism about technologies that come down. We have to build a trust with them, and we have to help them improve that. And that's absolutely where we come in to help to design those services and bring those encounters to life. And further to that, this is a technology like many others in the world at the moment that improves on a monthly basis to use them to the best of their ability, constant optimization improvements necessary, learning, feedback, and bringing in new experiences as they arrive. But none of this really matters unless you can get data flowing around the rest of the NHS, and integration is a huge problem in the NHS. And this is where Chris and his team come in. Chris.
Thank you, Adrian. I just say I always love seeing the native Dragon demos, because it is something that it's moving on very quickly. It's nice to see new functionality, new features, new flowing of information every time I see it as well, even though obviously you and me talk quite a lot, obviously, internally. I know there's been a few questions in the chat as well, just to say that we're going to do a few minutes at the end, and then we'll go through kind of all the questions that people are posting in the chat. But like I say, feel free to ask questions. We will review them kind of at the end as well. But as Adrian said, Dragon Copilot is a massive game changer from an efficiency perspective, but from an NHS and generalized healthcare, integration is a big challenge, and always has been for a long time, with integrating various different systems into each other. If you go next slide, please, Adrian, thank you. You can click a couple of times, that's fine, thank you. So from a integration perspective, since 2018, we have been working with healthcare as well as other verticals around the challenges of integration. And this predominantly comes around the fact that as an organization, you will have new style applications that will have programmatic capabilities. You'll be able to use APIs, for example. The FHIR API is a common API in NHS circles. But you'll also have systems and EPR systems, especially, that will either be potentially quite legacy, or they'll be heavily locked down and restricted, often behind a kind of VDI style solution. So for a few NHS customers that quite a few NHS customers that we talk to, there'll be something like you'd have to log into Citrix, for example, then you may have to log into a jump box, then you might have to log into another system, and then you get to the EPR. And on the EPR, there's very little footprint because of the critical nature of that application. Because of those layers and because of the lockdown nature of it, it's therefore very challenging to be able to do kind of integration as a kind of a wide remit. Next slide, please, Adrian. Thank you. And as I say, we have encountered a lot of these challenges and a lot of work over the years around this, and the fact that you need technology from an integration perspective that's going to basically give you everything all under one roof. If I can use an API for part of that integration, fantastic. If I then need to do part of the integration within the same process and I have to resort to other automation or maybe some AI capabilities, I absolutely want that. But I want to be able to do it all in the same process, all with the same kind of technology, all under one roof, rather than having to have this hodgepodge of different technologies. Next slide, please, Adrian. Thank you. And this is where, since 2018, we've been working with healthcare providers, as like I say, other verticals, and we've come up with something that we call IA Connect. I always say this when I'm doing demos. Yes, if I could go back in time and rename the damn thing, I absolutely would do. Intelligent automation was all the rage kind of when this became a real live product. But it does contain some AI capabilities, because IA Connect is designed to provide process automation, but it gives you the capability to mix and match different automation technologies all in one particular process. On top of that, if you have a VDI solution in the mix, such as Citrix, for example, or it could be AVD or Parallels or any kind of VDI technology, most automation technologies natively don't really handle VDI very well, if at all. It's generally, you have to bring the application to the system to make it work. From an EPR that's heavily locked down, that's basically impossible at that point. So ever since 2018, we have designed the solution that we're presenting on screen right now to basically work as a VDI first product, but it also does if you bring the application to the worker. And the way we've designed it is there's no installable agents, there's no software required on the VDI system, there's no software needed for the EPR system whatsoever. So it means that if you don't have access to things like APIs and any kind of programmatic technologies, you can still do automation. We are basically bought in, I always say, where you've got these very difficult applications to automate and provide integrations, and we're basically the SAS of integrating difficult requirements from applications such as the ones that you see below. It's not all about healthcare and Windows UIs. It could be web portals. It could be, I mean, we even integrate IBM mainframes, what we do behind the scenes. But for customers, the big thing that I want to stress with this is we are a Microsoft verified service. We sit inside existing technologies and basically give it capabilities that it doesn't have natively. So if you were to go into Power Automate, if you go into Copilot Studio, even if you go into automation technologies such as Blue Prism, for example, we exist as an extension of those systems. So you're not relearning new technologies. We are providing additional functionality to be able to do these integrations and make them wide-ranging. Next slide, please, Adrian. Thank you. And since late 2025, we have been working very closely with Microsoft to basically take the integration experience that we have provided to a lot of our healthcare customers, and basically working very closely with Microsoft to provide this integration between the Dragon service itself in terms of the outputs that you're generating through your dictations, and to be able to provide a way to easily integrate into a variety of different EPR systems. So it could be Oracle Cerner, it could be Epic, System One, Optum, which used to be called EMIS, Soliton. These are just a few. We have done others as well. We've done Rio, for example. I had a customer ask me last week for that one. And basically, we are the linchpin, as it were, between the Dragon output and actually providing an automated way of taking your outputs from Dragon automatically into the right place in the EPR system. So it means that you're getting the benefit and the efficiency of Dragon from what Adrian has demonstrated, but you're getting additional efficiencies around it, basically automatically going into the right place in the EPR system and under the patient's notes, basically, for an easier way of doing it. We are one of the first in the UK to basically offer this service from an integration perspective, and like I say, been working very closely with Microsoft to be able to bring this to life, and it's it's a big thanks to them and giving us the opportunity to kind of work on this as well. Next slide, please, Adrian. Thank you. And just to highlight kind of our kind of work that we've done previously, one of my customers, Connect Health, we have been working there for a number of years. To give you an idea of kind of a real case example where we've done this previously, they basically had a new patient registration requirement, but the output of that had to go across about 4 different EPR systems because they straddled between NHS and private medical. So not only was their own EPR system, they would then have to log into NHS systems to go to another EPR system. There was another CRM system, and all of this had to be kind of kept in check. All of this had to be kept up to date. Trying to do it manually was very, very time consuming. It was prone to mistake, prone to error. Things were being missed. It just wasn't sustainable, especially when you then had to scale it up in like winter periods with flu season, et cetera, around that. So they have basically taken our solution. We work very closely with their team to be able to build out these automated workflows that is custom to them, because everyone is slightly different. Everyone has very different requirements to each other. So it's not a product per se. It is a service that is tailored to you and your requirements and what you're using your EPR systems for as well. And for these guys, it meant that we dramatically reduced errors. It was a 24/7 automated service, and basically 85% of that particular process was now being automated, so they could concentrate on the more difficult ones where it needs a bit more back and forth as well. It was an enormous time saver for them and a really significant ROI for them as well. Next slide, please, Adrian. Thank you. And just very quickly, for the technical people in the audience, I always love to throw in a bit of a video diagram just to give you a little idea, kind of the nuts and bolts, as it were, in terms of how this fits together. So, from like I say, every customer is slightly different to each other. So we are here building out the automated integration workflow with you for your requirements in your EPR system. But this is a closed system that sits in your Azure environment as an organization. You effectively build the flows in something like Copilot Studio or Power Automate into what you need it to do. It automatically connects into the Dragon system. We take care of that for you. And effectively, our agents, our agent service, which are effectively virtual machines, they are the one basically logging in and using APIs, or they're logging into the EPR system where they can't access the APIs, for example, and doing the work for you on your behalf, basically, for the automation perspective. We also include things like Power BI reporting to show you how everything is going, to give you some ROI stats, et cetera, around that. And we also have some AI capabilities around Vision AI to be able to drive stubborn applications that may be slightly legacy in nature as well, without any software being required to be able to do that. the advantage this gives you is because this runs on the Azure platform, you're meeting compliance standards immediately regarding ISO standards, for example, CSA stars SOC 1 to 3. And as an organization, we're Cyber Essentials Plus certified. We're on the DSP toolkit from an NHS perspective. And like I said, we have complete compatibility with the FHIR style APIs that are common in healthcare as well for those APIs that are using that, and that's a preferred method of travel. Next slide, please, Adrian. Thank you. So if you click one more time, Adrian, for me, that will kick off the video, hopefully. It does take a couple of seconds to come to life. So I'm not as brave as Adrian with his demos. So I have a pre-canned demo here just to demonstrate kind of what this actually looks like behind the scenes. So this is an example of, it's a very basic example of basically doing a very short dictation inside of Dragon. Now that Adrian's done his demo, you'll see a kind of a familiar layout, as it were. You probably won't hear the audio, I don't think, on this recording. But effectively, we're just doing a quick bit of dictation on a particular patient that we've provided a few details on. And basically, one of my guys is prescribing some paracetamol to a patient. So he's clearly a developer and clearly a lousy consultant if he's prescribing paracetamol to someone. So Dragon is going to go away, do the dictation. What you're then seeing, you wouldn't normally see this. This would be behind the scenes. I am taking the iConnect system off hold because it's waiting for Dragon to kick into life. You can see here that it's got the data already from Dragon, ready to go. It's received the data, and I'm going to take that off hold. Basically, this is going to kick in the automated process of logging into the application. And loading up a dummy EPR system that we use for testing. So like I say, you would not normally see this. This would be behind the scenes, but for demo purposes, it's just showing you that this is not a person doing this. And this is my worst case scenario. I don't have any programmatic capabilities. I don't have any APIs to do this. IA Connect itself is driving this with a combination of Vision AI, as well as some light bits of RPA and a little bit of API for the Dragon service in the background as well. So basically, this is logging into the EPR system and loading in the notes for that patient. But also, just to do a wide-ranging demo, I have another system that I have to log into Citrix for. I've got a separate CRM system that I have to put that note in a separate system. So I can automatically log into a Citrix environment itself. It can then load up a remote application, for example, which is what it's doing at the moment. And I've got quite a legacy Windows style application that I need to load for that particular patient. It's going to prepare the application for me as a remote app. So I'm not logging into like a full fat desktop, although I could do if I really wanted to. And then iConnect again is going to load up that application. And again, it's driving the application here. It's going to log in, fill out all the details that have just been provided by the dictation. And it's also then going to add on those notes for me as well for that particular patient as well. This is basically like a bit of a very basic dummy CRM style system just to demonstrate that it's not all about the EPRs. This is a wide ranging technology from an automation perspective. Anything you've got in scope from an application for that process, we can probably handle it behind the scenes as well on that sort of things. So as you can see, the task is completed from an automation perspective. And we also record everything from an auditing perspective as well. So if there's anything like any kind of issues or whatever that may be, everything is trackable, everything is recorded, everything is auditable as well from that side of things as well. Next slide, please, Adrian, just as a quick wrap up. So leaves me to say, as Adrian started, I'll close us out. Really appreciate everyone joining us today on this webinar, just to show you the power of like the Dragon service in general from a co-piloting perspective, as well as giving you kind of an idea of the differentiator that we're driving from an Ultima Trustmarque perspective around integration with various systems as well, to give you a complete end-to-end efficiency saving from that side as well. I'm just going to check the chat just so there's any questions. So one question, Jonathan says, does the model learning organization specific language acronyms specialty workflows? How does it handle acronyms and medical jargon, Adrian?
Yeah, so the general medical model is trained in a lot of the acronyms anyway. It's actually trained in the country of origin as well. So it does that even sort of tunes more towards specific acronyms that are used, say, within the NHS, and we all know and love lots of acronyms in the NHS. The specialty models are trained in the actual clinical specialties themselves, so we'll pick up a lot of the information, and these are constantly trained in the background, right? So they're being updated as we go. So hopefully we'll get better and better over time. And even if it does miss those, there's that functionality to actually tell the model that some of these acronyms might be seen, and train it to interpret those correctly, but also present them correctly. So a huge amount of functionality, and you can do that, like I said, from an organizational level. So everyone gets the benefit of that particular acronym, and that I don't know, maybe it's just even the NHS trust name, right through to an individual clinician who potentially has such a specialty that and such brand new stuff that's coming through that they just need to give it a little bit more tuning.
Thank you, Adrian. One of the questions we had previously when we've done this in person that I'll just flag as well, because it was a really good question. We talked about taking information out of the Dragon service into the EPR, but what about the other way? Can we extract information out of the EPR into or around Dragon as we're doing this? So one of the things that is in the works right now is being able to extract diary style information out of the EPR alongside you doing your Dragon dictation. So therefore you've got all of the information from a diary perspective available to you alongside the integration, alongside Dragon. So it is bi-directional, but it's something that's not there today right now, but we know for a fact it is coming down the line very, very soon on that front.
Yeah. Any further questions?
Were there any attempts in application? So good question. So Dragon Copilot itself is designed purely for healthcare. However, the integration and automation that I demonstrated in the second part, that can be used anywhere in any industry. So we specialize in multiple different verticals, multiple different customer base. I even have customers in Canada automating very complex logistics. The life cycle of a parcel is probably the best way to describe it. So from our perspective, from an automation integration perspective, we can do pretty much anything. It's not just healthcare, but Dragon Copilot itself is aimed purely at the healthcare industry. I think that's fair to say, Adrian.
Yeah, that's absolutely right. But contextually, so the US health system works differently. For instance, it works across many private providers in the US. That's equally true here. Obviously, the focus in the UK is predominantly sort of the NHS for obvious reasons, but there are a lot of private providers that can support that can benefit from that as well, that support the NHS and sit around the NHS. So, but it's very much a healthcare product and very specifically designed, and I'm sure we'll probably stay in that space for much time to come. We've got time for one more question if there are any. Otherwise, I'm going to say thank you all for joining. Do give us a call, contact us if there's any particular use cases you've heard that you want to discuss. We recognise that these things are so specific, often to the environment that people work in, the particular organisations, etc. We are very well tuned to helping you to incorporate these tools into these various different environments, and look forward to hearing from you. Thanks, Chris. Thanks all.
Thank you.
See you soon. Take care.